So we're gonna do the debriefing on our last buyout of the year, which is unbelievable to think that it's already that time. So we couldn't have done this without the supporters' help to save these horses. So we're really, really thankful that we could get the 23 that we did yesterday. A lot of them needed us pretty severely, so we're glad that we could help them. This is B24516, and based on his brand, he's a branded standardbred. His name is St. Lad's Sailor, which I thought was pretty cute. Mm-hmm. He was one of the 3 that was down on the trailer when it arrived, and he was able to get up. He was a little shaky in his hind limbs from being down, and he had a lot of muscle fasciculation, so it was kind of hard to auscult him. So we're gonna have to recheck his heart and see if we missed anything, but we gave him pain meds immediately and then just kind of triaged him and looked him over. He had some lacerations on his face, over his eyelid, and other than that, he was just really nervous after he had gone through that event. He had some edema in his genitalia, but with a body score of 3 out of 9, it's less likely to be fat and more likely to be edema. But we didn't actually like palpate to see if it was pitting or anything like that. But so whenever you see edema, you have to think about kidneys, heart, things like that. But we couldn't really listen to him very well because he was shaking. So we gave him his microchip, his vaccines, dewormer, his pain meds, and then did some blood work on him and let him go. His blood work, we just did a CBC, which is a complete blood count. So he had lymphopenia, which means he has low lymphocytes, and neutrophilia, which is high neutrophils, but it's just barely outside of the range. So that could be stress, or it could be the beginning of something infectious-wise, and he had some low platelets, but it was just mildly below the cutoff range. So we need to look at him a little bit more closely to make sure we're not missing anything.
His eyelid swelling looked a little bit better this morning than it did yesterday. This horse we named Ernest. He was in really bad shape. He was down in the trailer and he was stuck underneath another horse. We don't have any control over the way horses come to Horse Plus. We work really hard to foster positive relationships with these shippers. They voluntarily choose to come to us, so I sometimes feel really angry with how horses present to us, but we have to stay really calm and continue to build these positive relationships with these people who are choosing to bring horses to us instead of taking them to die really unethically. So this poor boy had just really given up. He was in respiratory distress. His gums were almost white. And he could pick his head up just a teeny tiny bit, and he kind of made eye contact with me. I gave him some pain medication before we even got him off the trailer, but some of our staff jumped in and we were able to just kind of pull him off, and he just had absolutely no fight left in him. But he closed his eyes and took a really deep breath, and we asked him one time if he wanted to get up, and he did not want to. And we gave him the last act of kindness, I think. I aged him about 34. He was missing a lot of teeth. He was a body condition score of 1, so he was very emaciated. But I'm really thankful that he didn't suffer more than he already had suffered.
All right, so our next horse is B24518. She was a 34-year-old Haflinger mare. She was the last horse that was down of the 3 in the trailer. She attempted multiple times to get up and couldn't until all the other horses had gotten out of the trailer. And she was finally able to get up once she was out of the trailer. She was very weak in the hind end. She was having trouble breathing. She was in respiratory distress. Her heart rate was 80. She was immediately given pain meds, and she still had respiratory and heart rate elevations. You can kind of see it in the image. Her nose just looks bulbous, and she had a pretty significant odor coming out of her face. So we were able to get one radiograph before our radiograph equipment decided to poo-poo on us for us to charge it, and then we could use it the rest of the day. And we could see that there was a large mass inside her nasal septum. So based on that and her still elevated pain, heart rate, respiratory rate associated with the mass and whatever else was causing her pain, We decided to give her the last act of kindness because of that. She was a very sweet girl.
This Hackney pony was adorable. This is B24519. We had a really difficult time aging this boy because he was a cribber and he didn't have any incisors. So his wear, tops and bottoms of his front teeth was very severe. He did have pretty decent teeth in the back, so I was able to just look in his mouth and saw that he had some teeth. So I called him 20, but he could have been 30. He was blind in both of his eyes, but he seemed to be a very well-adjusted blind boy. He would listen and follow. And when I did his exam yesterday, he had a normal heart rate, but I missed a pretty severe heart murmur. There's a lot going on during our BUYOUT days. I make a lot of mistakes and miss a lot of things, but I missed this heart murmur yesterday. And we kept him up in a stall because we had some concerns about him. He was very, very thin, and he had some major blood work abnormalities, and so we wanted to keep a close eye on him anyway, and checked on him around 7 a.m., and he seemed pretty normal. But then one of our media team members noticed that he didn't seem like he was feeling well, and she thought maybe he was choking. He was kind of standing with his head down. And so our vet team went up to check on him right away, and it almost was like aerophagia. He had kind of an enlarged esophagus that wasn't a choke, and he just seemed really uncomfortable. So Dr. Gina sedated him just a tiny bit, and then both of us were like, whoa, this is a crazy severe heart murmur. I called it a 6 out of 6. You could feel it from the outside. You could hear it on both sides of his body. So we met to discuss this morning about this adorable pony, but we were just really worried about his cardiac status and his low body condition score. And then on top of that, the choke-like episode with the aerophagia was very abnormal and also likely not related to his heart. And he was really uncomfortable. And we gave him the last act of kindness today so he didn't have to suffer. Oh, this one.
Yeah, she's real pretty. This is B24520. She was an 18-year-old Percheron mare. She looks really similar to the babies we get. She's really cute, but Tawny noticed that her right hind foot just looked really abnormal and like it was,
It was like this wide, and it should have been like this wide.
Yeah, so we were hoping it was just neglectful farrier work or lack of farrier work. But when we took radiographs, there was bony involvement of P3. So based on the look of it on the radiographs and the way she was moving and the shape of the hoof, it was not a good prognostic indicator. And she was obviously painful in that foot. So we decided to give her the last act of kindness yesterday because of that.
After she passed, one of our vet support staff was able to look more closely at the hoof, and she said she could just put her finger in through the bottom and touch the infected bone without any resistance other than just fecal matter packed up there. But that's another reason why our radiograph equipment is so critically important in our ultrasound and our other diagnostics, because these guys are so stoic, especially these drafties. They're so stoic that when we first looked at her, we were like, maybe we can just get her on our priority farrier list. And without that x-ray, we immediately went, she has to be incredibly painful with this infection. I would have waited longer, and that would have been the wrong call. So this one was very heartbreaking. This little mare was only 2 years old. And you can almost see from this picture, she had deep suspensory limb desmitis, DSLD. You guys hear us talk about this disease all the time. And when she was standing with both of her feet, you can still see how severe it is. But when she was load bearing, those joints were like a centimeter off the ground. And she already had soft tissue involvement in her hind legs. So DSLD is something that we talk about a lot. I had a personal horse with the condition. He was diagnosed in his early 30s, and he was on 3 different medications, and I got another good 8 months with him. So if I see a horse with this condition in private practice, I'll often be like, listen, this is chronic, progressive, and curable. The longer time goes on and the more those soft tissue stretchers stretch, the more discomfort your horse is going to be in. But it does cause chronic pain. This little girl was only 2 years old and she already was quite lame in both of those hind legs. And then also her right forelimb and then her left forelimb was a club hoof. So these are congenital problems. This is a congenital condition. People should not breed horses with these severe congenital abnormalities. And this poor little filly was a result of irresponsible breeding. And we didn't want her to live a life in chronic pain. And so we had to give her the last act of kindness. So cute.
Look at all the big drafties.
I know.
It's okay. This is B24 522. She was a 35-year-old Belgian mare. She weighed 1230, so 1,230 pounds. She was a big girl. She loved treats. Someone wrote that down there. That was real sweet. She had a very elevated heart rate. It was 78. So she was given 10 cc's of Banamine IV and some Dorm, but she was still very painful. And she was very reactive to fast movement. She had a grade 3 out of 6 heart murmur, and she just was so painful in her front feet. I think you guys got rads. You guys got rads on her, didn't you?
45 degrees of rotation in both front feet.
Yeah, they didn't put the results down here on the paper, but I heard you guys talking about how bad it was.
I didn't write the results down. Sorry.
But she had severe founder, and she was just so painful and so large. And with both sinking of the bony column inside the hoof capsule and rotation, that's a lot of things that just basic trimming is really complicated to fix, especially in a big draft horse. So
she also had side bone with sinking and rotation. So she had extra bony prominences that were bending in and I'm sure causing discomfort.
Yeah, so she was given the last act of kindness yesterday.
She also was given a lot of pizza. And I do want to clarify that no one gave her cheese pizza. And also, we don't believe in being wasteful. But these horses deserve as much Christmas and love as they can get. B24 523. Sorry, these days are really tough days. And this was just yesterday. This little quarter horse mare was 23 years old. She had, the first thing I noticed with her, she had a really big scar. So she had a scar on her esophagus that affected both sides of her neck, probably from choking multiple times. She had a heart murmur, a diastolic murmur. And then she had a mass on her upper right eyelid that incorporated the lid itself and then the scleral tissue. And then she had a mass inside the globe of her left eye as well. She was very painful on palpation of her hind end. And when she was standing, you can't actually quite see in this picture. She looks relatively normal in this picture. So she kept standing and she kept pulling both of her hind legs under her body about as much as the left hind is right now. So she had some pelvic discomfort on palpation, but she was also very stiff. Her hind limbs would rotate abnormally, and she failed her proprioceptive placing. So you guys hear us talk about neurologic disease a lot. This mare, when we did proprioceptive placing tests, which is that those manipulations that we can use to see if her brain knows where her legs are in space, she failed those. So she had neurologic disease. She was very uncomfortable. She had her jaw was also clamped down. She did also receive pain medication. So if you don't hear us say we give them pain meds, we give them all pain meds if they need them. So she got pain medication intravenously. But she had a lot going. She also had fecal staining. You can see on the back legs, on the insides of her back feet, and then up underneath. She had a very, very scarred vulva. I think this was a brood mare. And then her anus was recessed very severely because she was so thin, and she had feces kind of like packed up around that pelvic brim and then on the external surface. So one of the hypotheses for that discomfort on the caudal part of her body was the possibility of a chronic uterine or urinary tract infection. If we had had more time and wanted to exhaust those diagnostics, we could have explored that via ultrasound. But this poor old lady was really uncomfortable, and we gave her the last act of kindness. Pull it together, Soph.
You're fine. You're fine. This is B24-524. He is less than 2.5 years old based on his teeth, so we called him 2. He's a little thoroughbred gelding.
He's a really smart boy.
Super sweet, calm, just a lovely, lovely boy. We have high hopes for him. We gave him a body condition score of 3 out of 9 just because he's pretty thin, but he's growing, so hopefully with some good nutrition he'll gain some weight. He's very good for pokes, very respectful and quiet. He does have some nasal discharge and a cough, so we got a nasal swab that we're going to send off to check on that. He did have increased inspiratory noises and wheezes, especially in his left cranial ventral lung lobe. So hopefully that'll resolve whenever that infection he has goes away, but we'll recheck him. And he also has a left hind limb club foot. You can't really see it in this picture very well, but more than likely, if he was bred for something athletic, that club hoof would knock him out of that.
But he's comfortable.
Yeah.
And with appropriate farrier care, I think he's got a great chance of living a comfortable, normal lifespan.
Yeah, so he got all his vaccines, his dewormer, his Equispot. We have him down for a lung recheck. We did a CBC. He has low hematocrit and hemoglobin, but his red blood cell count was fine and some lower platelets than normal, but other than that, we had no health concerns for him.
B24-525 is a Belgian gelding, super sweet boy. I aged him at 24. When they get over 20, it gets really difficult. And then this boy has no incisors, and I think somebody got a picture. He has a wonderful mustache, and then when you lift it up, I mean, it's just nothing. So I'm very not confident on his age, but when we age horses, we can look at cups and stars in the lower incisors. His incisor wear is pretty severe everywhere, but his teeth in the back, while he had some really severe points, I actually sedated him, and then I went ahead and did a dental. And he's got fully functional occlusal surfaces on all of those arcades now. So I'm thankful for that. It's always nice when we find something that's like, yep, I can make this big pointy part of your tooth go away right now and you're going to feel better. His resting heart rate was only 36, which is within normal limits. His gut sounds were normal. He did have an increased respiratory rate, but his lung sounds were normal. So that could have been stress. There could be a tumor in his lungs. We did not ultrasound his lungs, but that was an abnormality that we'll continue to keep a really close eye on. He does have cataracts in both eyes. Horses get cataracts just like humans do. It can cause eventual full loss of vision. He is visual in both of his eyes. Usually it makes them lose their ability to see in dim lighting more quickly. But this boy could definitely still see, and at his age, it's probably not going to bother him a whole lot to have cataracts. He does have some very significant changes on his blood work. We do a measure called hematocrit percentage that measures how many cells are circulating, and it should be in the 30s, and his was 68, which is extremely hemoconcentrated. That means his body was very, very volume depleted, and he actually was very thirsty and chugged water when he came in. He's also extremely anemic and also has very low white cell count as well. So those are all some big concerns. We have him down for full blood work recheck in 1 week, but he looked bright today. He's eating really well. He seems to be chewing a lot better. So we are hoping that we can get him to adoption. We body condition scored him at a 4 out of 9. So he is thin, but not nearly as, I probably would have put him at a 3. He's not as thin as some of the ones that we get. So we're hopeful for this boy, and hopefully his blood work improves.
This is B24-526. He is a 25-year-old Belgian gelding. We body condition score him of 2 out of 9. He was pretty thin. The picture doesn't really do him justice, but he was very beautiful. His heart rate was 32. He did also have a diastolic murmur, loudest on the left side. And he was also very neurologic in the hind end and failed the tail pull test, which is the proprioceptive placement test. You could even just watch him standing there and his legs would just kind of be in all sorts of funky directions and placement. And he just was like, la, 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 la. He was super sweet, but that kind of level of neurologic disease is not a great prognostic indicator for quality of life. So he was given the last act of kindness.
B24527 is a very cute 2-year-old mare. We think that she is gated. It's really tough for us on intake. We look at these horses and we're like, we have to assign a breed to these horses. So we called her a Tennessee walking horse. Tawny checked and her tail tendon has been cut. So I guess we have more confidence than normal that maybe she was intended to be a big lick horse. And we think that she ended up in slaughter auction because her left eye is very enlarged and has a really big scar and is not visual. So she needs surgery to remove that left eye. She's stable enough that we didn't have to rush her right into surgery when she got here. She's going to have a little bit of decompression time, but she is visual in the right eye. Her right eye appears to be normal. She's already halter trained. She was very, very good for our exam yesterday, even though she's only 2 years old. So she got all of her vaccines and her microchip. And as soon as she's decompressed enough that we feel like she's stable, we'll plan surgery to remove that left eye.
Oh, this one. B24528 was a 20-year-old gelding quarter horse Palomino boy. Halter broken. He was blind in both of his eyes and very, very painful, but he was not well adjusted. I could see him through the window. I was inside working on other horses when he came, and I could tell that he just hurt and was not happy with his life. So for quality of life reasons, he was given the last act of kindness.
He was grinding his teeth, and he was separated out from others, and we led him over to water, and he wouldn't drink, and we gave him hay, and he wouldn't eat treats. And he was just absolutely terrified and painful. It was really awful. Oh, B24529 is an old pony. I aged him at about 27, but age is just a number. It's not a disease. So this little pony has learned some life lessons. We were a little bit concerned about Cushing's disease because he was not on the thin side, and you can see the curly hair on his legs. So one of those classic signs for Cushing's disease, which is hyperadrenocorticism in horses, is hirsutism, which is kind of that thick hair coat that doesn't shed out. Thankfully, we can run that test in-house here at Horse Plus. So Dr. Gina ran those levels yesterday. The equivocal range for that test is between 15 and 40, and he was at 26, which is great. It means if he does have Cushing's disease, it's early, it's manageable. He's not past that point where we're really concerned, but he definitely is one that we're going to recommend has that test rechecked in 6 months. And there is a medication called Pergolide that's very effective at managing early to moderate Cushing's disease. So he's also, he's 27. But I'm hopeful that he might have a little bit of time. He's a super sweet boy. He really likes people and likes treats. We have not evaluated his dental health yet, but on palpation, his jaw is really easy to manipulate and his body condition score is good. So we have him down for a sedated dental. We'll definitely keep a really close eye on that blood work. And we're going to want to make sure that his hair coat stays healthy and we don't see other signs. The test result interpretation is you correlate it with clinical signs. So if you're looking at a horse and you're like, I see no other indicators that this horse might have Cushing's, it probably doesn't. But if you look at the horse and you're like, this really looks like it might have Cushing's, it probably does. So at his age, I probably would just recommend that adopters keep him on that medication. And I mentioned this earlier, we actually have supporters donate medications like that sometimes when they've had a pet on one, so I have almost a year worth of the medication that this pony will need that was donated to Horse Plus. So we're hopeful that we'll get him to adoption, but we got to look at his teeth.
This is B24 530. She was a 21-year-old paint mare. Yeah, she had a lot going on. Her heart rate was 78, and then she was given Banamine IV, which is a pain medication, and then after that she was unresponsive to it, and then she got to be over 100 breaths per minute. So she got worse after we gave her pain management, which is not something you want to see. She had a lot of nasal discharge out of both of her nostrils. She was having severe coughing fits, labored breathing. She was in respiratory distress. She had a lot of crackles and wheezes. Lung consolidation is a possibility, especially on the left side, based on Dr. Lydia's auscultation of her. And she also had...
You did a cardiac ultrasound on this mare.
I did. So when we looked at her on ultrasound, her left ventricle looked like it had some hypertrophy, which means that the muscle itself was thicker, showing evidence that there was cardiac problems. And then also we just kind of went a little bit dorsal of that view and looked at her cranioventral lung lobe. And on ultrasound, the pleural surface should be one nice bright white line, and then you'll see A lines that are horizontal with it. And if you see B lines, which are going vertical, that means that there is some kind of disruption to the pleural surface. And when we were looking at her heart, and you could look up at the pleural surface near that space, there were lots of B lines and obvious deformations in the pleural surface. So all of that together, we thought she had some pretty severe lung pathology, and her cardiac pathology was also pretty significant. So the last act of kindness was what was decided for her. Poor girl.
B24 531 is an 18-year-old quarter horse gelding. You can see, this is a great example. You can see in this picture, his face is really tight, and he was just holding his body in kind of a strange manner. And when I palpated him, he was very, very, very open and communicative about moving his body and where it hurts. So sometimes when you palpate horses, they just kind of clamp down, and sometimes they'll kind of do things. And this horse was like, please help me. I want to move things around. So he had some discomfort on his cervical spine, and just with some gentle kind of massage of his thoracic and lumbar spine, he really kind of moved things around, and he kind of licked and chewed, and but he consistently had stiffness at the top of his cervical spine. So, and otherwise his physical exam was normal. So Dr. Gina and the rest of our team took some really amazing radiographs, and we have to sit down with our anatomy textbook. So we're not radiologists, we're general practitioners. We think that maybe we see a little bit of irregularity, but the skull of a horse is a really complicated body part to interpret. There wasn't anything glaringly obvious with this horse. And today I just watched him out in pasture for a few minutes. He's moving around really well. He looks a lot more comfortable. So I'm cautiously optimistic that we can find out exactly what's going on with this boy and help him feel better. One awesome thing about a lot of the newer arthritis treatments on the market are that you don't necessarily have to know exactly where the problem is. You can give it in a vein, and it kind of finds the problem and treats it. So I think he's a good candidate for that. He's only 18 years old, but he definitely has some discomfort somewhere up in his head, and it's not his teeth. So we're hoping we can get to the bottom of it, but his resting heart rate was normal, and we think that he's comfortable enough to just decompress and finish out his quarantine. So he's gonna be in a pasture for a couple more weeks, and then we'll look more closely. And in the meantime, we're gonna look really more closely at those radiographs. His blood work was mostly normal. He's a little bit anemic, a little bit of low platelets. So B24 532 is a 17-year-old standardbred. His name is Wonder Boy Trent. He's a very good boy. He had a palpable knot on his left carpus, but when we took radiographs standing and flexed, the bony proliferation isn't in an area that should be causing him discomfort for using that joint, and he's clinically pretty sound. His physical exam was otherwise within normal limits. He has some major hoof neglect, so he needs to be priority on the farrier list, but overall, he looks to be relatively healthy. He needs a sedated dental. He got his vaccines and his microchip and dewormer, and he has turned out to decompress until he finishes his quarantine period.
Oh, this cutie patootie. This is B24-533. He was a 20-year-old quarter horse gelding. When he came out, he just looked like he felt kind of painful. So we ran our hands over him. He had some wither pain, and he was really reactive over his carpi. But once I sedated him, his carpi looked relatively okay. But when we were taking radiographs of his spinal column, he had severe kissing spine, like really overriding dorsal spinous processes. So based on that and how painful he was, even with some medication, the last act of kindness was decided for him.
This poor horse just like reached out to you with his face and was like, hey, I'm in pain.
He was really cute.
Yeah. B24-534 is a 21-year-old pony mare. This mare is funny because normally they have a baby face and they're ancient. This mare's face looks very old. She's got white hairs on her face, and her teeth look to me much younger than her body looks. So I aged her at 21. She was very, very head shy and very shy of her mouth being examined. So we put her down for a sedated dental. She does have a very low grade heart murmur. I graded it at 1 to 2. So anything 3 or over, got to have a cardiac ultrasound. In this mare's case, with everything that was going on, I could barely hear something abnormal, but I think I heard something abnormal. So we're going to put her down for a full cardiovascular recheck. She also has scleral injection in both of her eyes, which just basically means like when you have conjunctivitis and the surrounding parts of your eyes are pink and irritated, that's scleral injection. So her eyes were irritated and kind of crusty. She had some increased tearing. She responded very well to a dose of anti-inflammatory medication, and I kind of wiped her face off. And when we saw her in the field today, she was holding her eyes much more open. So I don't know if she had an allergic response to something or had trauma. Sometimes horses can get this from too much wind, like if they go on a long trailer ride. So we don't know what her history was, but little concerned about her eyes. So she's down for a full opto exam, sedated dental, check of her heart. But she was stable and seemed comfortable. And so she also is turned out. These older ones that need dentals, we try to get to them ideally the first week of buyout. Unfortunately, it kind of depends on our medical priorities elsewhere. So some of these guys don't get a dental the first week, but we'll get her teeth done soon so that she can gain weight in quarantine.
Oh, this guy. This is B24-535. He was a 23-year-old grade gelding who had some pretty significant left front lameness yesterday, but also generalized lameness. So he was one of the ones that we were concerned about, so we kept him up overnight to recheck him this morning. He was given IV Banamine yesterday and improved a little bit, but he was still pretty ouchy. He had what we could find on exterior examination was like a tiny little boop right there on his foot that looked like an abscess had busted out. So we took some radiographs and there was nothing super glaringly apparent with his foot. So that's why we wanted to recheck him today and just to see. We ran some blood work, just a CBC. He had a really elevated neutrophil count, more so than you would think with just a pretty uncomplicated hoof abscess blowout and low platelets. But when we rechecked him today, he was just painful everywhere. All 4 limbs were painful, and he was painful in his back. He was just kind of like all clenched up. He wanted to be a real good boy, but you could tell he just did not feel very good. So even though we gave him pain management and evaluated him, we just weren't able to really control it super well. So the last act of kindness was the best thing we could do for him.
He He had a bunch of abnormalities in his radiographs too. Dr. Gina and I were talking about it today. He's the last horse we radiographed yesterday, so all the images start to run together. This horse also had a pretty severe stereotypic behavior pattern where as soon as you weren't interacting with him, he would kind of take 2 steps forward, 2 steps back, and just kind of do this. And he would do that instead of eating. And so sometimes in those animals that have stereotypic behaviors for a long time, they develop pathology that's related to that. So I don't know if that's related, but he just generally, he was very sweet and he was trying to be compliant, but he was not happy. And sometimes the level of pain over time results in an animal that's just, he was using a coping mechanism to check out in the only way that he had available to him, which is really sad. Our next B number is B24536. She's a 23-year-old bay quarter horse mare. She's very, very, very sweet. She looks like she was used as a brood mare. She has a lot of mammary development. She's actually kind of like dripping milk, which is really sad because it looks like they probably just pulled a foal and sent her to slaughter, which is just awful to do right before Christmas. She has a very large wound on the inside of her right medial hock that Dr. Gina and I are very concerned might communicate with the hock joint itself. We took radiographs yesterday. They weren't really conclusive, but she seems really comfortable on that leg. So we just put some medications on yesterday, and she's actually waiting for us in our equine hospital right now. We're going to sedate her. We're going to run some full blood work on her, and hopefully we're going to clip and clean. The plan is to access that hock joint in an alternative location to see if there's communication between the wound and the joint itself. And if there is, the chances of sepsis are extremely high. She has fecal matter like packed on the wound, but if there's not communication and it's just superficial, we may be able to save that. She's a very, very sweet girl, and she needs a dental exam and sedated dental. She needs full blood work. She needs wound debridement. And even though she's at least 23, and it's hopefully she's not been bred, we're going to pregnancy check her just to make sure, because we don't want to have that be a variable and not know about it.
This is B24537. We aged him at 6 years old. He's a stallion, paint. He has a pretty severe cough and pretty copious mucopurulent nasal discharge.
It's banana pudding.
Banana pudding. So we swabbed him yesterday, and we're sending off the nasal swab for culture. We ran a CBC on him. He has surprisingly low lymphocytes and high normal neutrophils. They're still within the normal range, but they're not like sky high, which you would expect with the way he presented, unless there is another cause for his coughing, like COPD or something like that. He had low normal red blood cells, hematocrit, hemoglobin, and some low platelets, but that could be artifact or it could really be true. We would need to do like a blood slide smear to see, but we're hopeful. So we gave him all of his vaccines. He needs to be castrated, but it just depends on what his swab looks like and if he gets worse. We don't want to take him to surgery if he's possibly going to not be able to pull through it. We don't want to make things worse or harder on him. So to be determined on Mr. Studley Man.
He's been coughing long enough that he's got a line on both sides. His cough is pretty severe. So hopefully we can find out what it is, what it's susceptible to, and treat it. Oh, we caught him mid-blink. This is B24538. He is a young Mustang. We aged him about 7, and he's not a branded Mustang. So we're saying that based on appearance, not because he has a brand. He had no obvious health concerns. He doesn't seem like he's had any human contact, but he seemed to be smart and make some good life choices. And he got vaccines and a microchip, and he is turned out to decompress. And then he'll get a training evaluation once he comes out of quarantine. And that is our last horse.
And so when you look at our numbers, they're B24, blah, blah, blah. 538, which was that boy's number, that's how many horses we have saved through the buyout, has been 538 horses
this year.
And so that's pretty amazing that is the amount of horses with y'all's help that we've been able to save from a horrible, horrible death. And we know that Tawny and Jason have been doing a lot of work over the years to try and end slaughter or exporting horses for slaughter and things of that nature. A lot of other things too. They do a lot of different work, but every year the horses being exported for slaughter is getting lower and lower. And I think part of their efforts with like this buyout and things like that are contributing to that, and people getting to learn what's happening to horses. And so Tawny mentioned right before we started recording this that the amount of horses this year that have decreased to be exported is very close to the 538 that we have saved throughout the year. So whether or not that's correlation or not, we'd like to think so, but it's pretty amazing that we're able to get these horses out of that system.
Yeah. And we don't usually ask you guys for donations because we get to just go give everything we have to trying to save these horses. I'll speak for both of us. We couldn't do this job without being able to just decide what test we think needs to be done and just do that test, or decide what medication an animal needs or what procedure they need and just doing it. We don't have to go to Horse Plus and say, hey, can we send this off? We just do it. All of these diagnostic results that we're reading off to you cost money. We do them in-house. We do them as efficiently and as inexpensively as possible. And we have a lot of wonderful companies that support us and that give us discounts. But the reason why Horse Plus is able to save animals and is able to get animals out of suffering much more quickly than a lot of smaller rescues is because we have diagnostics and because we have professional trained people on staff who can quickly recognize and intervene. That improves outcomes for cases, and it also allows us to get animals out of suffering more quickly. So we couldn't do that without your support. We don't actually make Horse Plus any money as veterinarians. We just spend their money. So thank you for supporting the work that we do. It is really important. It's really hard work. It's hard on your heart. If you watch Dr. Gina and I, we love what we do. But this is a tough job, and knowing that we have thousands of people around the world who watch what we do and believe in our mission and support what we do, every little teeny tiny bit counts. And we promise that we do everything we can to use every dollar we have to get as many horses comfortable and into forever homes as we can. So think about us for your year-end giving if you have any flexibility there. But mostly just thank you so much for your support throughout this past year. It's been a crazy busy year. Dr. Gina and I both started full-time in January, but I've worked part-time for Horse Plus for almost 9 years, and I'm really thankful for this team. It's been a great year, and I'm excited to see what 2025 holds for us.